you found us on the map, the Mental Health and Addiction Podcast. I'm Kimberly Walsh, and I'm here with my partners in crime, the mighty Andy Panda Bernstein, and the incomparable Chris Perry Long. Hi, guys.
Hi.
Hi, how are you?
Good. So just a quick background on us. Chris Long has been in the industry for many years, dedicating herself to working with families and helping people get into treatment. Andy has been an advocate for mental health and addiction, both as a producer for Crosscheck Radio and through his own experiences. As for me, I'm a person in long-term recovery and the founder of a sober home for women on the Cape called Grady's Landing. We put this podcast together because all three of us are passionate about reducing the stigma around mental health and addiction. We believe that the more light we shed on these topics, the less people will stigmatize and punish those who suffer from these diseases. Moreover, we hope the information we provide and the topics we discuss will help encourage people to seek treatment. So, Andy, I'm going to shift it over to you.
Why, I thank you. And I have a new microphone today. I look like I'm a play-by-play man.
You're such a professional.
High atop Dodger Stadium. So yeah. So guys, how are you? How is everybody right now?
I'm good. Thanks for asking. Everything is I can't complain. It's another day above ground and sun is shining. It's not supposed to be so humid today, which is fantastic. Good. Meetings open up now, Andy, which is phenomenal. Just outside meetings, we're practicing social distancing, but we can feel that sense of community coming back with the girls and with other AA members, and it's really a positive thing.
That's good to hear. I know Chris had a couple of things to share as well. Chris, talk to us about what's going on in your world.
So last Friday, my son's COVID test came back positive. And he had lung surgery 2 years ago prior from vaping. And so, you go through that whole wave of emotion because there's been a huge uptick in kids in their 20s and early 30s that have lost their lives to COVID, and it just I went through this whole wave of emotions. I was really pissed because he's worked so hard to get clean and sober, and, COVID's going to take him out. That's kind of where I was. And then today I had to go and drop some stuff off for him at his apartment. And he's got a 2.5-year-old little girl, my fourth grandchild. And they live in a 3rd-story apartment. And I got to see her through the window. And it made my heart hurt that I couldn't just give her a hug or, say hi or hold her or get a kiss or anything. And it's just one of those things. It's out of sight, out of mind, unless it's in your kitchen, people don't have to deal with it, but then you've got all the news, which we always talk about, and all the uncertainties, and schools have to they have to provide 3 plans, have to be submitted and approved as to how they're going to, deal with COVID in their schools. And I was thinking about this last night because all over the news is how baseball has come back, and the Miami, whatever they are,
Marlins
had 9 guys test positive. And I was thinking to myself, no, they're being careful, and maybe they're not being careful. I don't know. But how are we going to put hundreds of kids back in school and not expect this to spread like wildfire if a baseball team can't even keep it contained? Or you've got the Chatham where when the story broke, it was 8, then it was 9, now it's 13. I haven't even seen an update on that of, college kids that got together. They were not practicing social distancing. They were not wearing their masks. And they all worked in restaurants. So it's I try to focus on the things that I have control over, but the world is just so out of control.
It is. And I want to add, you talk about the Marlins, not that their games were canceled. They also canceled the Yankees and the Phillies game, that whole series too, because of the quarantining. Because I believe the Phillies were playing the Marlins, and so to be protective, they also postponed their games too. So it's they are trying to be super careful, and I've been watching it. Obviously, no fans in the stands. The players are wearing masks in the dugout, and yet if Major League Baseball is canceling as well as, or some games, as well as the NFL has a bunch of players opting out as well of playing, and NBA players. You're right. It is scary, and I don't think we necessarily have it's kind of like the plan is not really the plan, because a lot of people have different opinions. Kimberly, it's interesting though, because Kimberly had a totally different perspective than you did, Chris.
Yeah. Yeah.
And
On what?
on COVID, you're like, oh yeah, everything's opening up, people are getting back together. It
Well,
seemed like
practicing social distancing. I mean, when you attribute all the suicides and the overdose from the isolation that it's caused, I mean, I'm not taking anything away from the fact that it's a deadly disease and we all need to be practicing social distancing and wearing our masks. But I think that when that happens, I think that in order to make sure the economy stays on track, to make sure people stop being depressed, and the mental illnesses are skyrocketing and all those things, that needs to be addressed as well. You can't let go of one to focus only on the other one. I think they should be both looked at. They're both pandemics, like Chris has said before. Both. This is a pandemic here, and it's a pandemic in the drug and alcohol abuse and mental illness sector too.
I'm in the middle of the whole thing. I'm confused, and as I've said all along, because on one hand you see, if you, like George Costanza said on Seinfeld, it's not a lie if you believe it. So I think about it like, if I what I mean is like, if I can channel my thoughts and say, you know what, I'm gonna just focus on what I control, not watch the news, and just live my life regardless. Well, yeah, then it's good, right? But if I don't bury my head in the sand and I pay attention, and you listen and you hear, it's just confusing. And I think having a lack of a overall focus, from let's say, here's what we're going to do, right? This is our uniformed plan. Here's what we're going to do. Here's how we're going to tackle this. And yeah, it sucks to wear a mask. Nobody's taking your freedom away, but we need to do this in order to get things better, to at least, and no, it's very uncomfortable for everyone, but we got to do it. So that's my 2 cents on it. But without getting into a political issue, we're going to introduce Scott Allen, our special guest. What do you think about that?
I think it's great. Let's go.
Okay.
Do it. Go for
All
it,
right.
Andy.
We'll get off this topic, because otherwise we'll get in a lot of trouble, and then we won't, everybody's got an opinion. So let's meet Scott Allen, who is our special guest today.
Good morning.
Good
everyone.
morning. So let me introduce you, Scott. And Scott Allen is a retired chief of police from East Bridgewater in Massachusetts, and he recently retired. And Scott has over 25 years of law enforcement experience. He is a certified police academy instructor, community activist, and regional law enforcement leader, advocating for those struggling with substance use disorders and behavioral health issues. And he played a lead role in creating a regional substance use drop-in center in 2015 as a volunteer with a nonprofit, EB Hope. And he and his partner in the fight, Chief Mike Boltieri from Plymouth, really created a revolutionary program. And so Scott's going to kind of talk to us today about what he's doing today and how it all came to be. How about that?
Great. Well, thank you, Andrew, for the introduction, and Chris and Kimberly. It's great to be with you here this morning. Yeah, my career, as it worked its way, started in 1994 in law enforcement, and a lot of what's happened here in the last, and I say it's about the last 8 years or so, it's really happened organically. When I started out my law enforcement career, my vision was that I would retire, from law enforcement, with a goal to maybe do some instruction and teaching at some point, which I've been doing for the past 15 years, at the police academies. But in 2012, for me, at the time, I was a drug task force commanding officer for a regional task force, and we were in the throes of the OxyContin crisis, and I find myself, all we were doing at that time really was, OxyContin cases and investigations. And I got introduced to Susan Silver, who was a local resident here in East Bridgewater, and a mother of a family member who'd been struggling with opioids, use disorder. And, Susan started EB Hope, and I started attending the EB Hope meetings with the idea to learn more about, addiction and the science of addiction and how we can help others. And just from there, it grew organically. In 2012 with EB Hope, we started doing some informational, community events to make the community aware of substance use disorder, because at that time there really was a lot of unknowns. I mean, even it took me to get involved with EB Hope, and then later with PARI, the Police Assisted Addiction Recovery Initiative, to really learn about addiction and the science of addiction, and that's a disease. Because my training and focus, had been, investigations, seizures, arrests, and, that's all we really knew as police officers. And for us, it was this dramatic shift. EB Hope was the start for me, and then PARI, for those that aren't familiar, in Gloucester, Massachusetts, at the time, the police chief, really stepped outside the box and said, if you come to the police station, we'll help connect you with treatment. And it really was just from that point, from 2012 on, it's really been an ongoing learning environment for myself, learning about substance use disorders, about the science behind it, and really learning from the experts, because police, we're not the experts. I
Right.
say this all the time. We have this front row seat, but we want to rely on the experts in public health, in the addiction and science world, to help us better serve our public. And really, that's kind of how things have evolved for me organically.
So, uh, so you and Chief Botieri kind of partnered together and really became a very nationally recognized organization with in your previous role, the partnership that you created. Can you talk a little bit about the kind of the partnerships you forged in the Plymouth community and kind of how it manifested itself to, as you said, organically to where you are now?
Sure. So at in 2015, I'd first helped create a local drop-in center through EB Hope with Susan Silver and the team there. And as we found that there was a need to provide resources and information, at the same time that we had opened the drop-in center in East Bridgewater, Chief Pateri down in Plymouth had partnered with Beth Israel Deaconess and was doing post-overdose outreach work. And throughout 2016, we engaged quite often, and we're learning about one another's initiatives. Down in Plymouth, he had partnered with 3 other communities in BID Plymouth. We had, expanded our drop-in center to take on a regional approach here in the greater Brockton area with some neighboring towns and our partners in Brockton and the Brockton Champion Center. And what we did is we exchanged ideas, and it really just morphed into, we took on some of the post overdose outreach work that Plymouth was doing. Plymouth opened a drop-in center down in their region, which then expanded to a second one, or actually a third one in Wareham. But we decided that for us to really have an impact with our initiatives, it only made sense to do it on a regional scale. And at the time, we were able to work with all of the chiefs of police, all 27 chiefs of police in Plymouth County, who all signed a memorandum of understanding to commit to being a part of what became Plymouth County Outreach in late 2016, early 17. And then working tirelessly with the district attorney, Tim Cruz, and Sheriff Joseph McDonald's Drug Task Force, we found that this collaboration needed to engage. We had the law enforcement commitment, but we really needed to show and work with our our healthcare partners. So it just expanded. We got the region's hospitals to buy in, if you will, and to collaborate with us. We formed an advisory board of chiefs and doctors, and it just expanded to where the entire county, even though each municipality might have had their own initiatives, working on a larger scale made the most sense. Because what we found was that early on, 40% of the people that overdosed weren't overdosing in the town that they lived in, but were overdosing in a neighboring community that prior to Plymouth County outreach, there was really no information sharing. There was no formal process to share that information, and not only share it, but then connect those at-risk individuals to referrals to treatment and resources. And then the other big piece that we added early on was what we found is educating and arming family members and loved ones with support and information to the resources. We found that by showing, and you touched on it earlier, I heard you talk about stigma. That stigma is so strong that not only persons that are struggling with substance use disorders are still, dying because that stigma is so strong they don't seek treatment, or family members and loved ones can't get out and find the resources, or are afraid to get out there. So we just worked tirelessly to have this collaboration grow, and it really became the group you didn't want to not be a part of.
Isn't it interesting how, and we're going to hear from Chris and Kimberly, but isn't it interesting how I met you guys a couple years ago, and I remember asking you a question about, it really sounded like police work really has changed in a lot of ways, because there's more of a different approach in areas like substance use disorders and things, where you can't really lock people up anymore. That's not really the answer, how you solve the problem. You kind of were ahead of the curve right now with what's going on out there, as far as the way police work is being talked about.
Yeah, yeah. I mean, go ahead. I'm sorry.
I think that what you guys did, okay, down on the Cape, was nobody wanted to follow in your footsteps over the bridge. Well, you know what I mean? Like up in this area, like what you guys did. I mean, Pari was amazing. What Pari was doing was great. They just didn't, when they initiated their Pari program, they just didn't have the power to get the word out enough. And it was groups like you guys and what you guys did down in East Bridgewater. I mean, you involved Bridgewater State University. You guys encompassed every demographic, person, place, thing. You brought everything in. I remember
built a community. They built a community.
I remember walking into the church, to one of their drop-ins, and I saw you, and we had a history already, and I was like trying to figure out where I knew you from, and I was like, wow, I had no idea. And like you walked in there and it was welcoming. There were people of all ages. There were families. You watch a family come in and they're so broken and they don't know who to talk to. And it's like, you're greeted by a greeter and they walk you through A, B, and C. And if you have your loved one with you, you had an area where your loved one could actually speak freely about what was going on. And you busted your butts to get help for that person, regardless if they had insurance, money, or no insurance. You made sure that there was no stigma, that you broke so many walls. But what saddened me was that nobody like up here wanted to jump on that bandwagon. Like if you look at the statistics for like the Cape was losing people like there's no tomorrow. And slowly but surely, because of your door knocking, because of your drop-in centers, because of what you did, because you were in front of this, your numbers drastically dropped.
Cutting edge. They were really cutting edge with their program.
And I appreciate that. I mean, I think the one thing that we, always were mindful of is we were looking to build trust, because, and now more than ever, law enforcement, obviously we need to build trust in communities. We need to build trust in, marginalized, underserved population. And we need to make sure that as law enforcement, we are serving every population of individuals. And really that's, it was the really the basis of the foundation. It did not matter who you were or where you lived. If we could connect with you, we wanted to connect you to the resources that existed. And it really was taking relationships, establishing relationships that lead to partnerships, which really lead to truly collaboration. And then at the end of the day, it's putting aside egos, because one of the challenges that I see across the country is, there's that competitive nature. Well, whose area is this? It's all of our area to work together to collectively connect people to treatment and long-term recovery, so that lives can be saved, and not fighting over, well, who is the lead agency, or who is and who are you partnering with. We partner with everyone.
Do you and Kimberly? I don't know if you have any thoughts. You're being you're hiding in your little box over there. Tell us. Do you have any thoughts?
I think she's frozen.
She's frozen. So given what you're saying, I mean, so really the face of, I mean, do you kind of see, from meeting you guys, understanding what you're doing, and then hearing about the face of, what they're talking about today with police work, it's kind of like police are challenged now, law enforcement's challenged with, wanting to be looked at as a resource in a lot of ways, not just the enemy, right? I mean, that seems like that's really been kind of your mission on some level, correct?
Yeah, we talk about smart policing. I always use the term, it's really community policing 101. We want to be careful as far as, I always said we don't want to become an entity. We're not, treatment experts. We're not mental health experts. What we can do is we can educate our officers and our teams to have a better understanding of substance use disorders, mental health disorders. That, I call it policing through a public health lens, because really what we need to do is collaborate more than ever with our public health colleagues who are the experts. And that's the one thing I always found myself, and I know Mike, when we would talk, we always found ourselves saying, hey, we're not going to step outside of our wheelhouse, but we do have this front row seat that if we can collectively, adopt this shift in policing, as to looking at the underlying causes, the social determinant health needs of individuals and families, if we can look at it through that lens, and not necessarily and always thinking of crime, but the underlying causes. And then if you know how to navigate and have some familiarity with the treatment, substance use, mental health treatment system, you can then connect those individuals and families to the right resources. And really, it is that community policing 101. You're going to see your calls for service decrease to those repeat locations and individuals, because you've been able to connect them to the resources that they truly need.
Right. So there's some outcomes there. There's some measurable outcomes through the work that you're doing, or with like organizing and having a holistic approach to this.
Absolutely. I don't know. It looks like we might have Kimberly back there.
In her little, in the box, in center square, like Hollywood squares, and you could be
What's wrong with my internet? Sorry about that.
What are some of your thoughts, Kimberly?
I was just going to say that I've seen it on the front lines, and I think that your movement is actually making some changes, because a lot of the girls that I talk to are saying that they were helped. Their last line of defense, their last hope was a police officer who actually cared, who took the time to help them get into treatment, and still they stay in touch with them. And I thought that was fantastic. So
great point.
Kudos to you. It's working. Yeah.
Well, so that's why I hear, when, like I was saying, you hear the news and people are like, oh, they're going to defund the police, or they're going to come up with different kinds of, oh, there's going to be more social workers and things like that. And I, knowing you guys, understand what you've accomplished with your initiatives. And so I'm like, well, it might not be such a bad thing to be able to have people who have a general understanding of something that is not necessarily is more of a mental health issue or a disease rather than a criminal thing. So it might not be the worst thing in the world, but I think if it's kind of explained in a better way, it might, it might resonate more because like you, I mean, you guys, like Chris was saying, I mean, you guys really were and are cutting edge in your approach. So fast forward, and I love to get your take on that.
Yeah, no, I mean, well, one of the things I might not have stressed enough and talked about as far as partners, the recovery community. Early on, we learned that we needed to collaborate and partner with the recovery community. And the neat thing with our program early on was, I had the opportunity to do about 30 home visits with the recovery coach. And the recovery coach that I partnered with, we shared this publicly because he shared his story publicly. He and I knew each other from my prior experience as an investigator, 20 years prior. But so what the neat thing was that he and I, here we are, we're partners, we're a team, knocking on a door together, sitting down in living rooms and kitchen tables with individuals who was at the throes of suffering from substance use disorder, family members and loved ones. That was really just a powerful experience for myself, and then to really build on that. So when we talk about those partners, it's law enforcement, it's the public health, the recovery community. I say they are the core foundation of why this works, because you need someone with that lived experience. We can talk all day long, but if you haven't been there, done that, or can't put yourself in someone else's shoes, I mean, that's really powerful. Um, but so I wanted to highlight that. But the other part, back to when we talk about the defunding the police, I've always said from day one, we envisioned our model morphing, which it has had. Initially it was officers with the recovery coach knocking on a door, but at some point I certainly see I see the ability to do a co-response model. I see the most effective ways to do it in a co-response. There are absolutely cases and situations where the behavioral health expert, they should handle the situation themselves,
Right.
and you don't necessarily need an officer involved. But by having that collaboration where the day-to-day operations have public safety working with the behavioral health experts and collectively deciding, is this the type of situation that warrants a co-response, or is it maybe it needs a law enforcement officer, or maybe it's a combination of other partners. So I mean, I really see the evolution of this being, this the intersection of public safety and public health, behavioral health experts making those decisions together. I feel, and I'm concerned that by, the shift of saying, hey, just, take this away from law enforcement, police officers really can help their behavioral health experts, on cases where the behavioral health expert may not even be familiar with these families and people. But so by having that sharing of information at the front lines, I really feel like I'm hoping that is going to be how this works out. But I do see at some point police taking a step back and saying, "Hey, you are the behavioral health experts. We've helped used our front row seat to promote this movement. Now let's bring it to that 2.0, 3.0 level."
How do you think it's been on in your world? I mean, in Plymouth County? I mean, how did you see the response? Do you find that people really responded well to that approach?
Yeah, one of the things that we took on early was, we established a data-driven strategy, and I think one of the things we learned from our public health experts is you talk about efficacy, and you talk about, research and analysis. So we absolutely, we're looking at that early on. I can tell you, in our engagement, in my community, I had an awesome team led by, Sergeant William Patterson. I mean, our engagement rate, on these outreach visits was about 75%, which if you had said 5 years early to some of the experts, 3 out of 4 doors, you're going to be sitting down at a kitchen table or a living room, the experts would have said there's no way that's going to happen. But, the engagement and the reception was absolutely astounding. Collectively, across the county, the engagement rate is somewhere between 65% and higher. There's absolutely individuals who don't want treatment, but even those interactions typically are positive and saying, "Hey, thanks for covering. I'm not interested." But what we saw is by showing that we cared, by breaking down the stigma, by bringing the resources to their living rooms and kitchen tables, we found people would reach back out a week, a month, or 2 months later and say, "Hey, you know what? Appreciate you coming by. I'd like to take you up on that offer to get connected to a resource." Or mom and dad would say, "Hey, my son or daughter is now ready. Do you think you can, still connect us with the recovery coach or with the clinician?" So, the engagement again was really astounding and continues to be astounding. Even in the COVID, I still talk with our coordinator from Plymouth County Outreach, Victoria Butler, and even though they're doing a lot of the work remotely, they've still had a successful engagement. So it's, the stigma really is the piece that this type of program, breaks down those barriers because it shows that you care.
Um, well said. And so that manifested itself to where you are today. So if you could tell us about how you transformed kind of the great work you did in Plymouth County and how you, took that and built your own organization to try and take it to a whole nother level.
Sure. So in January of 2020, this past January, I announced my decision to retire from the department to pursue my passion to work with others and share what I had learned and helped to create through these initiatives in Plymouth County. And I was able to partner with and form a new company with a group out of Virginia called Community Services Solutions. And the program that we have created is called Operation to Save Lives, and it's utilizing the basic principles that were the foundation for building, the drop-in center in East Bridgewater, EB Hope, and then the foundation for what we built through Plymouth County Outreach. And again, it's that foundation of collaboration, building relationships, and build partnerships. And I had struggled for the last year, probably as the chief in East Bridgewater, where I was so engaged in our initiative with Plymouth County Outreach. Was sitting on the Governor's Council for Sexual Assault and Domestic Violence because we saw a lot of co-occurring issues with victims of domestic violence and suspects of domestic violence with both substance use and mental health disorders. Working with our district attorney, Tim Cruz, I had created in our department, an innovative program called the Kid in Need program because we were identifying, drug endangered children, not knowing it when we respond to these calls. And what we found, in learning from the district attorney's office and their training was that there was a gap there. We weren't collaborating with our school partners and making sure that they understood within reasonable information sharing agreements that the student that might be not doing well in school or falling asleep in class, it wasn't because they were a problem child, it's because they had been exposed to either trauma, violence, or substance use within the house, and not their problem, but the problem of mom and dad or a sister or brother. So it really, it expanded, and I was challenged in my last year where I found myself, being committed so much to the Plymouth County Outreach Initiative, doing presentations, going around different parts of the country, that I really had this strong desire to share and create, this program, but doing it, on as an active chief of police, I couldn't do both roles. So, my background was in education. I always wanted to be a teacher. I had been teaching at the police academy for 15 years. It means changing the complete program. We will certainly do that, based off of the data and the research. And then the other thing through, Operation to Save Lives is that, I've got this ability on a national landscape to really share with others. I'm engaged with, I've done so much work in advocacy with PARI.
I was just gonna say, are you bringing in PARI, because PARI, it's
PARI
right along those lines.
Yep. So PARI, I will always promote and push for the PARI message and mission. And I talk with Allie. We've talked regularly about how we can support one another. There's other groups out there too that we're looking to expand.
Scott, what's the acronym for PARI? I'm sorry to interrupt you.
Yep.
So our listeners.
The Police Assisted Addiction and Recovery Initiative, which started in 2015, and really for the collective body and law enforcement, that was the game changer for all of us. It really stopped, leaders in law enforcement in general, to really look at, the science of addiction differently.
And it didn't even, John, easy,
Yeah,
it was just.
but it was finding that that the law enforcement, and the public, the police officers, they do have that front row seat to a lot of the issues, because unfortunately, when people are in crisis, they call police, they call 911. That's what we teach our kids to do.
Right.
So even though we, as police officers, when we get to these calls, we may not be the best suited professional to handle the incident, by now educating our officers to recognize that, hey, this is an underlying substance use disorder or co-occurring mental health disorder. By recognizing that, we now can bring in the experts, and really that's the crux of what we promote through the Operation to Save Lives and through our model is partner with the experts, work collaboratively, because there's a lot of challenges, and that's what the value we bring through O2SL is, that I can share the challenges and the obstacles that you're going to encounter, just through these collaborative models. I can share how we work through those challenges, how we overcame those challenges, and then how to really build the partnerships. Again, it's you're really, what I found a lot of times is that different entities might say, geez, I love what you're doing in the substance use, we want to do this in our own siloed area. And I would say, hey, let's just do it together, because the more silos that we create, the more barriers in
Yep.
the less chance that there'll be information sharing. Just like I talked about with drug endangered children, in 2012, 13, 14, 15, it was never in my mindset as a police officer, hey, I'm at a domestic violence call, and there's children that live in this home that are exposed to this trauma, and the trauma and the impact that has on their lives, which we know through the ACEs study, adverse childhood experiences. By understanding that as a police officer, I'm not saying, hey, now I'm this expert in drug and children, but by training the officers to recognize that you've got to deal with the domestic situation, you've now got to look at those underlying causes for the victim first. You got to look at the suspect, but then you got to look at those children and say, how do I help connect them to resources that they need? And it's really that collaborative approach.
It's go ahead, Andy.
Oh, I had a question. Okay, so I would imagine maintaining credibility is probably incredibly important in this work, or maintaining that, you uncover through some of the people that you encounter. Maybe there's more to this, right? Maybe they have information about a particular, like, I don't know if situations ever arise where you're like, okay, that person has access to or has information on a drug ring or things like that. How do you, like, do you kind of not disregard that, or do you kind of, like, how do you maintain your confidence, or your and still police?
Yeah, no, it's a great question, and it was something that we recognized right from the start, and it was because of engaging with public health experts right from the start. The one concern that we heard when we started getting into this arena, if you will, of engaging with at-risk populations was, well, you are police officers, and the unintended consequences, you're really just gonna, the perception will be is that you're looking to pursue investigations cases. So we were very clear from the start, even in our not only in our messaging, but in our protocols, was that this is not investigative in any such way. And we segregated it. What we told chiefs, fellow chiefs, and recommend now through our program is, you cannot have an investigative body interacting with an outreach team, because the credibility of your program, you will lose that credibility. So we were very clear on that. What we found, coincidentally enough, is that organically, our intention, and we make it clear, hey, we're here on an outreach visit. We want to connect you to resources. We want to help you. We're not here to talk about anything enforcement wise. We're not here to talk about, any type of criminal investigation. And you make that clear. And we in our 2-day training, we make that clear. We spend about a half a day on role playing because it's so critically important to stress that, because the one negative situation or interaction that turns into that, that's going to spread throughout the community, and you will lose that credibility. So we're very clear. But what we found organically is that you would have family members, loved ones, and actual substance use disorder individuals say, "Oh, by the way,
Yep.
here's my drug dealer." And what we would do is we would just pass that on organically to the proper resources, but we never commingle investigations with outreach.
Got it.
I'm amazed that sometimes when you start working with somebody and it's a process. Some are, want to go into treatment just like that. Others, it takes time. You're building that trust. You're building, we said it early on, you have somebody come in and they're kind of like checking it out. And then maybe a month later, 2 months later, 3 months later, they're like, I'm ready. And when they're ready, they like throw up all the information, about, because they want to get rid of, when they're done, they're done. They want those people out of their lives, and they're vulnerable, and they don't want to get connected to those people. But it's really scary because like the signs that say kill your local heroin dealer, right? I hate those things because my kids in the heat of their addiction were dealing, like not because they wanted to, but because they had to in order to feed their habit. And when you help somebody understand that, and you break down that wall, that stigma, people are more open and willing to share that kind of information. I've had kids call me and they've begged their dealers, if they come to them, please don't sell to them. Please, I'm trying to stop, please don't. And they'll still deal, because I don't know. I mean, I've never witnessed it, but I guess when you're sick and you really want it, you'll pay whatever the price is. And I love to hear when they say, okay, you know what, they're not a bad person, but they're not a good person either. And with, as far as police goes, if I introduce a police officer to somebody who is in active addiction, they're automatically going to go, I'm going to get arrested for what I'm doing, and if this particular police officer has more resources than myself or someone that I know, then, you just have to show them that hope. And it is about credibility. I mean, I've never heard of anybody saying that they went into a EB Hope or Plymouth outreach and somebody got arrested because for whatever reason, I mean, I think Gloucester was a great segue for you guys, because what Gloucester did was like, they never imagined. I mean, I remember watching the numbers go up, but they never imagined that they would get to the numbers that they got. And finally, it came out that, listen, ethically, I guess, if you walk in and you have an outstanding warrant, we're going to have to arrest you for that warrant. But what they did was, we will walk you through the process and get you the help. We're not going to arrest you and sorry, can't help you. They walked you through that process. They helped you take care of that warrant, and they made sure that you got the help that you needed, which is, it's crazy. People don't hear about the good stuff that police are doing. They only hear about the bad stuff.
I heard Kimberly earlier, you talked about, some of the input, the feedback you've heard. I mean, I'd be interested to hear what your thoughts are on that.
Yeah, absolutely. I was a little bit shocked too to find that not one, not two, but several of the girls that have come through said, when I was finally ready, I had, because they usually have the same police officer, because they're in the same town, they're with the same people, so the same officer is the one who gets involved, and he sees them time and time again, and instead of just throwing up his hands, he'll actually take them, get them to treatment. He'll put them in touch with the right resources, which I thought was absolutely amazing. And what I wondered is that, are other police departments absorbing this? Are they kind of implementing these things? And do you have plans to continue to expand cross country? How big do you think it'll get?
Yeah, I mean, right now I've probably had engagement, with law enforcement, public safety, public health leaders in about 20 of the states right now. Our we absolutely are looking to share this model across the country. There's a lot of great work that's already being done in different parts of the country. I've partnered up with some other chiefs, active and or retired chiefs in other states who are in this similar arena, and we're sharing a lot of the similarities, but then there's a lot of differences. I mean, one of the big challenges early on, for Massachusetts, we were the first state in the country for law enforcement to be carrying naloxone, Narcan, and talking about harm reduction. Quincy, our partners in the Quincy police, were the first in the country to be carrying that. Thanks to the work of Dr. Dan Muse from Brockton Hospital, who signed that first open script. But
Great guy.
Dr. Muse what a great partner.
Yep.
But as I'm talking with different states, like one of the engagements is in talking with some counterparts and colleagues in Texas, and they're at the point now where it's some departments are just signing on to carrying naloxone, where we were doing that 2008, 2012, 13. So you do see in different parts of the country, there's a different perception, and that's one of the goals of O2SL, is that we want to get out there in these different parts of the country and share, what has, had some early success. And again, when I talk success, our numbers are still across the country are going up. I mean, I'm tracking this daily, and you're seeing, unfortunately, the 2019 numbers. The CDC just put out an early report that it looks like we're going to see the numbers go up in 2019 from 2018, and then 2020 we know is tracking, unfortunately, a result of COVID-19, or what appears to be a result of the impacts of some of the consequences of COVID-19 that 2020 is targeting up. So I mean, there's still so much work to be done. There are definitely other states that are doing some great work, and then there's definitely some other places where I think we can really bring some value for them to change that perception, because there's still different places where it's hey, the enforcement, the investigative side is the way to approach this. And again, I have always said that there's definitely a piece for that, to target those distributors at the high end that are killing people daily. But then there's others that, is there a better outcome if we can connect them to treatment instead of putting them in jail, and then seeing that cycle of that revolving door?
Right. We can't arrest ourselves out of this.
No. So I have a question. So obviously, and I'm learning this, and as I get older, personnel is probably the biggest thing to carry out missions, right? In my opinion, like, on paper, it's like, okay, well, we want to do this, 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 but do we have the horses to help us implement? So when you're talking to, any of your clients or any other police departments, is there a kind of a certain type of person you're looking for? Like if you might assess, yeah, your guys, you may not have the right view at the top or the front row seat person. Are there people, will you have like a criteria of who might make sense for this kind of role?
Yeah, so to me, that's a two-part answer. So the first part is at the leadership end, you have to have the willingness from the top. If the buy-in is not there to promote this proactive outreach type engagement, if you don't have the buy-in at the top, and I'm talking if the chiefs, the command staff, the fire department, EMS, if you don't have all of the partners at the executive level that are willing to do this, you're gonna encounter challenges throughout. So, and that's why when we designed our O2SL curriculum, we needed. Recognize early, you've got to segregate those, because our curriculum looks a lot different at the executive level than it does for the boots on the ground, if you will, because there's different things that you've got to think about from the executive level, and it's that policy making. But again, you got to have that buy-in. And when you talk about the outreach specialist, and this is public safety, we call it first responder outreach team now. It's police, it's EMS, it's EMTs, paramedics, working in collaboration with recovery coaches, clinicians, social workers. I always say there's no curriculum, there's no set. It's got to be this type of person. They've got to have a willingness to listen, to be open to new ideas in policing, in public safety, and to really have a willingness to just jump in, adopt harm reduction principles. If you have that willingness to be open to change and to looking at this through a different lens, that public health lens, that's really the key thing. And most department leaders are going to know who those people are. And most departments are filled with those type. I mean, police officers want, every police officer wants to help someone. And I think finding the right fit within each department, it's not a challenge. It's finding, sometimes it's everyone wants to do it, and you just can't have, every officer engaged, in this role. So sometimes you do see that.
Ladies,
Scott, how do you get them to that place? I mean, is it through education?
Yeah.
What kind of, are you physically going to the different departments and asking them to implement these programs?
Yeah, so right now, one of the challenges of COVID for me and for and my new endeavor here is getting out there. So what a lot of what I've been doing is having, conversations like this, sitting down on a Zoom or a Skype and just talking to leaders and sharing with them, the value that I found in my role as the chief and in my community and in our region, and how it helped us not only as a community but as a department. We really built up a lot of trust within our community by, adopting, not only, the Plymouth County outreach work, but then expanding it into all these different areas. So it's having those challenges. What we do is we'll go out and we will do site visits as, travel allows us to, and assess, because a lot of people are doing some work in this arena, but they may not have that quite that collaboration. And that's where I think the expertise that we can bring to the table is, we can find those gaps, and then very easily, and even just in some of my, Zoom and Skype calls, I've been able to give some direction and suggestions on how to fine tune things and enhance existing models. And so, and what the work that I'm doing now is, if you have no program, we can help you at the leadership level and help you, get the boots on the ground growing. But if you have an existing operation or program, we can help assess it, and then, based on our experience, tell you how we can improve that, collaboration even more so.
can you give us yeah, thank you. This has been really informative, and
Love it.
yeah, talking to, Scott's so dedicated and does really good work. Can you give your website address and how people can learn more about your organization and
Sure.
how they can get in contact?
So we're on we have a website. It's the letter O, the number 2, S as in Sam, L Lima.com. So we're on the web at o2sl.com. We're also on LinkedIn under Operation 2 Save Lives. And what I'm finding is I've been engaging, because of some of the travel restrictions, we're finding a lot of engagement through, through LinkedIn and collaborating with other partners, so we can be found at those two locations. We've actually got a couple of video webinars coming out very shortly. We've got a great board of directors of some active retired police chiefs, a public health doctor of public health, Dr. Nathaniel Horowitz Willis, who's actually at the Mass College of Pharmacy and Human Services. And we're going to be doing a live webinar later on in August with a national panel of public health and law enforcement experts from a couple of different states to really share, some of the work
Excellent.
that's been going on. But yeah, no, that'd be, I appreciate the opportunity to share.
So thank you for coming on, and please reach out to Scott if you are interested in learning more. Kimberly, so thank you. And Kimberly, take us out. We're going to, Scott, we definitely want to have you back, though, if you'll come back, if we didn't scare you away.
No, I appreciate it. And it was great meeting you, Kimberly. Great seeing you again, Chris. And
Nice to see you too.
I definitely look forward to circling back and talking some more with your group.
Thank
Great.
you.
Thanks so much, Scott.
Thanks.
Well, that's our show for today, guys. As you know, we do this podcast not only to help reduce stigma, but to be of service to anyone struggling with addiction or mental illness. We have access to an entire network of professionals, and we can help you find the right fit for your needs. So please reach out to us on our Facebook page or at the numbers given below our names during the show. You've been listening to The Map, and thank you all again for your support of our mission, and we'll see you Friday at 9:30.
Have a great rest of the week.
Bye, everyone.
Bye-bye.